Great. Good morning, everyone, and thank you for your patience as we're starting a few minutes late. Thank you all very much for attending the September meeting of the Procurement Council. We do have some business to conduct, and we also have some great informational materials. So I'm going to start with calling the roll. So Jason DiGianni.
Here.
Margaret Becker. Sorry, you're just announce for us your name.
Jim Ionesco.
Great. Beth Warren.
Here.
Valerie White.
Here.
Sean Cullinane.
Here.
John Evers.
Here.
Jacqueline Brilling. No. Okay. Julie Suarez.
Here.
JP.
Here.
Lisa Davis. Tom Hipchin.
Here.
Paul Murray.
Here.
Andrew Ruby. And Clinton Richards.
Here.
Great. So, based on the roll call, we have quorum. Sorry, I'm trying to get my papers organized here. So the first thing we want to do is acknowledge some new seats on the Procurement Council. We want to acknowledge Clinton, who's the Director of Contracts and Procurement Support at ITS. Did I get that right?
Procurement and contract support.
Procurement and Contract Support. It's the first error of the day. We'll keep track today. And then also Andrew Ruby, I think this is your first meeting, right? And you're the Director of Fiscal Management at the Department of Health, and you started at Budget. Is that correct? Okay, great. And then I believe Jacqueline is not here. Jacqueline is a legislative appointee. If she comes in, we'll introduce her. Otherwise, we'd like to introduce her while she's in the room so everybody can meet with her. And then Jason DiGianni, I think you're now the seated board council member for DOB, right? Okay. So I think that's all of the new stuff. If you are new and you haven't gotten a chance to get a primer on the council yet, or you haven't gotten a chance to do your ethics training for the council, we'll be sure to get out to everybody to make sure that everybody has all of the information they need. So the first order of business is the meeting minutes from the April 17th, 2019 meeting. So is there a motion to consider the minutes from that meeting, or a motion to approve?
I'll move.
Sean? Great. There's a second. Jason? So the meeting minutes are on the table for approval. Are there any comments or corrections about the meeting minutes from the April 17th meeting? Okay. Seeing none, I think because this is procedural, we're just doing a voice vote or a show of hands. So all in favor of approving the meeting minutes, please signify by putting your hand up. Great. Any objections? Any abstentions? We have 2 abstentions.
Because I wasn't
right?
there.
Okay. We have 13, so that's 11. So the meeting minutes pass. Okay, great. So I have 2 updates that I owe this council. The first one is on the rules work group. We established a rules work group a number of months ago. The rules work group has had their first meeting. It was fairly well attended. If other people are still interested in participating in the rules work group, we will make that available. The rules work group went through a series of potential rules for the council. We went through some procedural rules about voting and requesting to be on the speakers list, just procedural items that have never really had any governance on the council. We also talked a little bit more about all of the responsibilities that are and opportunities for this council that are listed in the statute. And there's not really a procedure for some of those actions to be taken. I think this council has become more and more active over the last 2 years. So those were the 2 big conversations that went on. The request from the work group was for staff at OGS to draft a set of rules to be reviewed by the work group. They identified that it would be easier to review a proposed set of rules than it would be to start from scratch. So we have the next rules work group meeting in October. I think it's October 3rd. And the expectation is that there will be a draft of rules to consider for that. One of the tasks we've given the rules work group is that they decide what belongs in rules versus what belongs in some of the other guidelines or bulletins that the council puts out. So are they operational rules for the council, or are they other kinds of things that need to be administered to? The other task we've given the rules work group is to think about what happens after the work group is done. So after there is a initial set of rules, what the procedure would be to add rules or change rules going forward. So the work group was very excited about the potential for rules about rules. By very excited, I mean there was silence on the phone, but we have tasked the work group with that also as part of the challenge going forward. So the procurement guidelines, I want to actually take this opportunity to thank everybody who has given us an inordinate amount of feedback on the procurement guidelines. We have done the best we can as staff to keep up with that, but everybody has been very active in putting that in. We know we have one outstanding set of comments that we're working through. So I know we had set, certainly OGS staff had set the goal of presenting all of that to you today. Timing wise, we believe we need to get through the rest of the comments. But I wanted to take this opportunity to publicly thank everybody who either personally or has had your staff dedicated to that process. It was an excellent and robust conversation. It will bear fruit. There is obviously there are guidelines coming forth. And we're certainly willing to answer questions about those, but there'll be plenty of opportunity to see what has come out of all of those conversations coming forward. So again, I wanted to take that opportunity to give you an update on the timeline. Our staff absolutely believes in the responsibility of making sure all of the feedback is incorporated. So that's what we're working through right now. So thank you all for your patience on that. Did anybody have questions on the quick update on rules or on the procurement guidelines? Okay. So under new business, there are proposed procurement council meeting dates with alternates for next year. I believe staff worked with a lot of you to make sure that as many folks as possible were available for all of those dates. If you do have any concerns, that would be great, just to let us know. We're not happy you have concerns, but it would be great for you to let us know. And so as you can see, we're keeping with the tradition we have started in 2000. I think we started late in 2018, where we have 2 meetings early on in the year, and then we have a gap for the summer, and then we have 2 meetings in the fall. And you can see that as far as we can tell, we have avoided all of the major holiday conflicts. We're not positive of that, so we really would appreciate you to review the dates and make sure we didn't miss anything. Feel free to send them. If you have comments now, we'd be happy to take them. Otherwise, feel free to send those comments to staff. And they are doing everything in their power to accommodate the council schedule. Did anybody have anything they needed to raise as a risk now with those scheduled dates? So next item of business is a standing item for legislative updates. So we'll pass that over to Tyler Feen to share with us any legislative updates.
Good morning, everyone. So all we have for this meeting as a legislative update is the extension of the MWBE bill, which some of you are probably familiar with, but I'll give a quick overview of some of the highlights. There was a lot of stuff done in this bill, so I'm not going to hit every piece of it, but I'll give you the bill numbers afterwards if you're interested in looking up the full text. The most significant thing that the bill did was extend the program for another 5 years. So the MWBE program was scheduled to expire at the end of 2019, and that has now been extended to the end of 2024. Couple of other changes that are of note for this procurement council The discretionary purchasing threshold, which under current law is $200,000 for agencies and authorities to be able to make purchases without a formal competitive bid, that is going to be raised to $500,000 for discretionary purchases from certified minority and women-owned businesses and New York State small businesses and service-disabled veteran-owned businesses as well. One kind of caveat to that, it doesn't apply to purchases of New York State food. The discretionary threshold for food is going to stay at $200,000, but it's going to go again to $500,000 for purchases of everything else. It also changed the term of an MWBE certification from 3 years to 5 years, and it changed the personal net worth cap from $3.5 million to $15 million. And then lastly, it established a workforce diversity program that will require state agencies who are doing construction projects to establish EEO goals on the workforce used on those construction projects. So again, that's just kind of a highlight, an overview, but if you're interested, the bill numbers, it was Assembly Bill 8414 and Senate Bill 6575, if you're interested in looking up the full text. And that's all we have for legislative updates. We'll continue to monitor for any other bills related to procurement and share any updates that we have along the way.
Great. Thank you, Tyler. Valerie, I know this is a program very close to your appointing authority's heart. Do you have anything you want to add?
Yes, thank you. We're very pleased that we now have the authority to go forth and do some of the other expanded terms that are included in the bill. So there's requirements in terms of outreach and working within the region and customizing programs so that we can get more MWBE participation in regions, but thinking about what's happening in those regions from a business standpoint. We'll be promulgating, the bill gives the executive director, who's me, the authority to promulgate a number of rules in relation to the workforce diversity, some issues related to the P&W in case there are industries that the $15 million cap might still be too low. And also much more in terms of compliance with prime contractors and fraud provisions. So we're very excited, and the team is working really hard to start to implement the program, and we look forward to the support from the Procurement Council as well.
Great. Thank you. Are there any questions from the council about legislative updates? Okay. Seeing none. The next standing item on our agenda is reporting, specifically as most of the reporting is about the preferred source items. So, John Normile, do you want to report on the 3 items on the agenda?
First, as of September the 4th, 2019, OGS has not approved any items under its standing authority since the last report given on April the 17th, 2019. In regards to NYSED's report on mail fulfillment, a report dated July the 29th was emailed to members and posted on the website on August the 13th. OGS asked for and received a clarification we received it September the 4th. Staff to the council will distribute that report after this meeting. And so, Sean, I'll just read the key difference in this report versus the first one. NYSED's member agencies have not performed any new mail fulfillment services since being granted approval to offer this service on November 28, 2018. The third item is single source reporting. This is just a reminder. And let me get to that. The Commissioner of OGS, on behalf of the Procurement Council, has received 23 reports from New York State agencies for the period 2018-2019. These reports were submitted to OGS pursuant to Subdivision 15 of Section 163 of State Finance Law, which requires New York State agencies to report annually the total number and dollar value of single source contracts awarded by the agency during the fiscal year, and the percentage that such contracts represent of the agency's total number and total value of contract awards during the reporting period. Is that sufficient?
Thank you, John. Are there any questions about any of the reports? Okay. So seeing none, part of what we do at this council is we try to make sure that all of the folks on the council are informed about the things that are going on that may affect procurement. Today we are very fortunate to have Mark Kissinger from the Department of Health, and he is here to do a presentation on Executive Order 190, incorporating health across all policies into state agency activities. Mark, thank you for being here.
Thank you, and I'm here with Charlie Williams on my staff. We're going to pass out a copy of the executive order so you guys can have that and refer to that. So I'm very pleased to be here to talk about Executive Order 190, which is the Health Across All Policies, Age-Friendly New York. It was promulgated in November of last year. The governor's executive order seeks to increase collaboration among all state agencies to promote age-friendly and healthy aging considerations into routine agency actions. Age-friendly policies or practices are things that enable people of all ages to actively participate in the community activities and treat everyone with respect regardless of their age. Healthy aging, which hopefully we're all doing at the moment, developing and maintaining functional ability and well-being into older adults, older age for all people to do so, to prefer to age where they want to age. So this is an overall approach that we've been working on with the governor's office since 2017. So the goal of this order is to make New York healthier for all residents through cross-governmental strategies that target social determinants of health and other complex factors that are often the responsibility of non-health partners, such as housing, transportation, education, environment, parks, and economic development. The Health Across All Policies and Age-Friendly New York goals for 2019-2020 are to continue and update and implement state-level actions that incorporate health across all policy methods and support healthy aging, and to embed health across all policies and age-friendly New York into government processes. The goal here is to embed these processes to have long-term sustainability, things such as purchasing, contracting, and grant-making, state plans, and other things. Under the executive order, all agencies are required to consider the health impacts of their policies and programs and to include language in procurements, contracts, and grant-making that gives benefits to contractors who similarly include considerations to improve overall community health within their work. The order provides that age-friendly considerations should be addressed where practical and feasible for best value procurements where price is not the determining factor. And you can see the actual term on the executive order. So in the executive order, wherever possible, the default should be include healthy aging and age-friendly concepts, or at the very least includes bonus points for applicants representing areas or providing services in communities that have been declared AARP age-friendly communities in all grant solicitations. The executive order, as you see, breaks down 10 criteria that relate to healthy aging and age-friendly concepts. Agencies should evaluate the goal or purpose of the procurement or grant to see whether any of these 10 concepts or criteria can pertain to the potential applicants or bidders, noting that every criteria may not be appropriate for inclusion, but the goal is to try to get as many in there as possible. I'll go through the 10 opportunities or criteria to give you some familiarity. You can use these concepts under each criteria to help determine how best to incorporate these concepts as part of a procurement or grant. We've been encouraging agencies at a minimum to consider including appropriate domains as bonus point questions, with each agency free to determine the number of points allotted for each criteria addressed in the application. So this executive order has a lot of flexibility in it. It also has the where practical and feasible language, because sometimes it just won't work. But the overall concept here is to embed these concepts into all government procurements, state plans, plans we require to the federal government, and such. So I'm going to go through quickly the criteria or the opportunities. The first opportunity is improve alignment and coordination of prevention agenda priorities. The prevention agenda, if you go to the DOH website, is a blueprint for state and local action to improve the health of New Yorkers in 5 priority areas. There's an Office of Public Health Practice within the Department of Health. It works closely with county and local providers to track progress, develop programs, provide much-needed information based on the best practices and data resources to implement programs within these areas. So these are really, it's really the state's prevention, the health department and the state's prevention agenda. And you can find a lot more information on the website. You can see the priority areas there is to prevent chronic disease, promote health and safe environment, healthy women, infants, and children, well-being, and prevent mental and substance abuse disorders, and prevent communicable diseases, all things that we would all want in our state. The next criteria is impact on the ability of individuals to continue living in their communities. So preserving the ability to residents to age in place and remain a part of the communities and involved that they choose is the preference for all older adults in New York. Think of your own families, and everyone wants to live in their communities as long as possible. So under this criteria, considerations can include how does the applicant increase availability or access to services in community settings like private homes or community centers, and what activities does applicants engage in that enable people to remain in their own communities. The third opportunity is opportunities for civic engagement. So this one is included that ensure that all people of all ages in all communities have opportunity to be active members of those communities and have a say in their community's actions. Under these criteria, considerations include how does the applicant encourage individuals of all ages to participate in community activism and service provision? How does the applicant engage with their local community and partners and decrease opportunities for volunteering? And what activities does the applicant engage in that support ways for older people to continue to work for pay or volunteer their skills? The fourth criteria is strengthening infrastructure for home and community-based services. So the goal of this consideration is to promote access to HCBS, or home community-based services, which allow people to remain in their own homes while receiving care that may otherwise be provided in congregate care settings. So the whole approach of our healthcare system is to serve people in the community, not in institutions. So under this criteria, considerations include how does the applicant support engaging community members in utilizing HCBS where appropriate? How well does the applicant describe partnering with local service providers to increase access to home community-based care? And how does the applicant describe supporting organizations to identify individuals to receive HCBS through this funding? So this one is a little bit of stretch in a lot of the procurements, but this is another criteria that's in the executive order. Strengthening wellness, longevity, and quality of life. Under this opportunity, considerations include improving accessibility, walkability, and service delivery in all communities, from installing bike lanes to creating more green space. Under this criteria, considerations include, does the applicant describe any activities they engage in to support the livability of their community? How does the applicant support accessibility or promoting a set of features that promote the built environment to make them more accessible to people of all ages and abilities? And how does the applicant describe the sustainability of outcomes and deliverables beyond the funding period? This is more of a general criteria as well. The next criteria, criteria 6, is promotion of a community's unique characteristics that support healthy aging. This opportunity asks agencies to have applicants consider the community's unique characteristics that could strengthen and support healthy aging. How will the applicant integrate into the community where services are provided to be delivered, and how will they improve it? Under this criteria, things such as how does the applicant describe existing community resources to support healthy aging and informal caregivers in the community? Is that proposal really supporting the caregivers or healthy aging in the community? And how does applicants leverage existing community strengths to support older adults in the community? Do they know anything about the community? Do they understand what the service provision are and how we can support caregivers? Criteria 7 is the inclusion of healthy and age-friendly communities. This section details the inclusion of local partners, counties, cities, and municipalities that have been certified as age-friendly communities by AARP and the World Health Organization. The goal is to establish a top-down, bottom-up approach where state and local initiatives are supported and reflective of each other. We are the first age-friendly state in the country. However, there's a number of counties, cities, and towns in New York that are also age-friendly. So under this criteria, considerations include awarding bonus points to applicants that are members of the age-friendly network of states and communities, for providing services in the age-friendly communities, or obtaining a letter of support from the members of the AARP network of age-friendly states and communities. So we want to give preference to age-friendly communities to try to grow that movement across the state. Criteria is inclusion of older adults, adults with disabilities, and their caretaker ask their applicants to consider how their activities will impact these populations and what they might be able to do to better support and include these populations. So how does an applicant reduce barriers to the delivery of health care in the community? And how does the applicant describe supporting caregivers and or people with disabilities through its services? Is it even on the radar screen? Caregiver support. Many of you know, but about 80% of the long-term care services in the state are done informally or by caregivers. So this is really the long-term care system and the system of support. I'm sure many of you have had personal experience with this as well. Like the previous criteria, this considers how applicants will identify caregivers and what their response to their needs. So how does the applicant describe the extent to which they support caregivers in their workforce or community? Does the applicant know who in their workforce is a caregiver? And do they have the support programs available to them? Do they have flexible work hours or work approaches? Or do they have appropriate information and referral services for people that are caring for adults with disabilities or older adults? The next criteria is criteria 10. And this is increasing consumer access to health and supportive services. The goal of this criteria is to increase access to quality health and supportive services across the state. Under this criteria, considerations include how does the applicant describe increasing access to either health or supportive services or both? And does the applicant describe leveraging their network and potential funding to identify and educate those in need of services in the community? So those are just a quick run through the 10 considerations in the executive order. And I just want to talk a little bit about the executive requires that these be considered in all your procurements. You should talk to your counsel's office about the actual application of that. We have several agencies that are doing this right now. We also have a work group every Thursday morning that you all are invited, or your agencies are invited to. If you have a particular question on something, Thursday morning calls at 10. It's open. It's an open invitation for different agencies to call in to try to figure out how this works for particular procurements or plans or procedures. As I said, this executive order covers procurements. It also covers any state or local plan that you have to submit to the federal government. A lot of us have funding plans that come with additional funding, or any other policies and guidance that we're trying to put out. There's contact information for myself, Mark Kissinger, and my staff member, Charles Williams, who's also on this task. We're open to questions and considerations, and thank you for allowing me to run through this executive order that is now active. Thank you very much. Any questions?
Yes, Tom Ipshin from SUNY.
Hi.
How do we get contact information for the Thursday call?
Just send me an email, and we can send it. We can send it out to you. I'll send you the call-in number.
Mark, do you want us to send to the whole council that
Sure.
last slide at least?
Yeah,
or
we could do
any
that,
part of the
definitely.
slide deck?
That'd be very helpful. And we welcome questions. We realize this is a different concept. It's a different type of executive order. We're trying to nudge forward on state policies to really incorporate these policies into all procurements. So we have a lot of questions from different agencies, like that just doesn't affect me, or how does it work with I've been doing this procurement for years. Now I have to consider this. How do I do that? So we're open to that, and we're ability to provide technical assistance and kind of think through these issues. So thanks. Any other questions? Sure.
Jason?
Can we get the entire slide deck? Is that possible?
Yeah, sure.
Yeah.
We have it. We'll definitely. We'll send it around. Okay.
So, Mark, would you provide that to staff, and we'll provide
Sure.
it out to the whole council?
Absolutely. Yep, definitely. Okay.
Anybody else?
Okay.
Great. Mark,
Thanks for your
thank you
time.
very much for your
Thank
time
you very
this morning.
much.
What we have left on the agenda is open council discussion. So I have a couple real quick items. First one is we had a request for an additional presentation on the local food purchases from one of the council members. We have postponed that at previous meetings. We have that on the list. So we're hoping to do that at a future meeting in the near future. But many of you will notice that the agenda was fairly short today. So I want to say two things about that. The first thing is you're welcome. The second issue is that, the same as we've mentioned at other meetings, there are points where OGS only has so many items to add to the agenda. So as council members, if you have things that you believe the council should be talking about, if you have subjects that you think should be done as a presentation, we welcome that. We encourage that. This council is required to meet a minimum of 4 times a year. So even with an agenda that doesn't have voting items, we will call a meeting and need to have quorum and all of those things. But since we're going to be meeting anyway, we just encourage the council members to consider if there are other things they want to talk about. For now, since the Rules Committee has not come up with a procedure yet for how that works, please direct those items of interest to staff or to me, and we would be very excited to consider that. I just thought we would take that opportunity to put that invitation out there. And then other than that, are there any other open items that the council would like to put forward for discussion right now? Sean.
Thank you. Just a question on the, you said there's a requirement for 4 meetings per year, which I understand. Is there a requirement that the meetings have to be face-to-face, or can any of them be, conference call?
So my understanding is it's required to be in person, right?
It could be by video conference. It can't just be by conference call.
So you'd have to have an in-person meeting, but could people participate by conference
But
call?
people could participate by video conference. The difficulties we've had is the internet's not always reliable. And the concern is then suddenly we don't have quorum for the people who did travel. So far we have not set that up.
So I think if that's something council members are interested in, and we think there's an opportunity for increased, activity and involvement, we have no problem with that. I know some of the work group meetings have been done that way. So if that's something folks are interested in, please raise that to us, and we'll see. Sean, we'll assume that that is something of interest to you at least. Yep. We'll take that as homework. To see exactly how we would leverage technology to help these meetings be equally successful or more so. We will come back with some feedback either directly or through the rules work group about what that does to voting and quorum and those sorts of requirements so the council's aware of the risks. Okay? Tom.
Just want to remind people that there's OSC forum training in October that people might want to sign up, procurement training, which is the 22nd and 23rd, Jim? Okay.
Jim, he may have stolen your thunder.
Oh, I didn't know. Oh, you.
I'm glad Tom's on board with it.
Okay. So if Jim or Tom, if either of you have that material, if you want us to remind the council of that, staff would be happy to do that. Awesome. Okay. Valerie?
Yes, and I should have said this earlier, just a reminder that the 2019 MWBE Forum will be taking place here in this very facility, October 2nd and 3rd. We welcome everyone to participate. I know a lot of the agencies will be present, but we generally have about 2,500 people here, and it's prime contractors, the agencies, the MWBEs, and it's, really lays out the efforts that everyone in the state has put forth for the program. So, and it's a good time, so we hope to see everyone there.
Valerie, same invitation. If you have a save the date or an
yes,
event notice,
we
we'd
actually,
be happy to send that out through
I
staff.
will, because the link for the conference is open, and we're accepting registrations and the like, so I will send that and ask that you send that out.
This is actually a great example of what I was talking about. If folks want to share this kind of stuff, make sure that those reminders are on the agenda. This is a very large procurement community that is represented at this table. So we're always encouraging that kind of stuff. So thank you for that. Other open council discussion. Very proud of us. We had 3 whole open council discussion comments today. Okay, so seeing no other comments, the chair will entertain a motion to adjourn. Jason DiGianni moves it. Tom Hipchin seconds it. All in favor of adjourning, please signify by putting your hand up. Great. Just for the sake of thoroughness, does anyone object? And does anyone abstain? Okay. So the motion to adjourn passes. Thank you all for making the effort to be here today. And keep in mind the priorities for your organizations, making them, if you want to make them available for discussion, we'd love to have those conversations. Thanks, everybody.